The emergency room doors slammed open at 2:47 in the morning. A Navy SEAL, unconscious, bleeding from 3 entry wounds, was rushed past the nurse's station on a gurney moving too fast for anyone to stop it. The storm outside had knocked out half the power. The backup generators were cycling. And standing in the middle of that controlled chaos was Emily Carter, 29 years old, wearing scrubs and a hospital ID badge that said Staff Nurse, Level 2. "Move her back," the chief surgeon ordered without looking at her. "She's not cleared for this." Emily stepped back. She pressed herself against the wall and watched. And when the monitors flatlined 11 minutes later, when every senior physician in that room went quiet with that particular silence that means we're losing him, she was already moving. If this story is pulling you in, stay with me until the end. Hit that subscribe button, drop a like, and tell me in the comments, what city or country are you watching from? I want to see exactly how far this story travels. The storm had started around 9 that evening, the kind that came off Lake Harrow without much warning. Heavy, lateral snow that turned the roads into glass and pushed the overnight trauma volume at Raven Creek Military Hospital past what any reasonable staffing plan could absorb. By midnight, 3 of the 4 trauma bays were occupied. By 2 a.m., the waiting area held a retired MP with a dislocated shoulder, 2 civilian vehicle collision victims, and a 19-year-old National Guard kid with a hand injury he kept insisting wasn't serious. Emily had been on since 7 the previous morning. She was supposed to have gone home at 3 in the afternoon, but Valeria, the nurse who was meant to relieve her, had called in sick, and nobody from the float pool was available. And the charge nurse, a heavy-set man named Dennis Kowalski, who had been at Raven Creek for 11 years and believed in neither overtime pay nor apologies, had simply pointed at the schedule board and told Emily her options were stay or find someone to cover her. She stayed. By hour 19, she had that particular hollowed-out feeling behind her eyes that came with being awake too long under fluorescent lights. She wasn't sluggish. Exhaustion for Emily didn't work that way. It had never worked that way. But she was quieter than usual, operating on something closer to muscle memory than conscious thought. She'd inserted 2 IVs, administered a tetanus shot, documented 4 patient charts, argued with a physician's assistant about a medication dosage she'd caught as a near error, and eaten half a granola bar over a trash can in the supply hallway, because there hadn't been time to sit. She was finishing the last entry on the guard kid's chart when the ambulance bay doors opened. Not the regular entrance. The ambulance bay, the reinforced double doors at the east end of the ER that were used for critical trauma and almost never opened without a radio call ahead. They opened without warning, no radio call, just the mechanical groan of the hydraulics and then the cold, which arrived before anything else. A wall of it, 20 below, with the wind factored in, sweeping through the ER like a second emergency. 4 people came in with the gurney. 2 were paramedics Emily didn't recognize, in gear that wasn't standard county issue. 1 was a man in military utilities, no rank visible, moving with the kind of purposeful quiet that told her he was trained. The 4th was a dog, a large Belgian Malinois in a tactical vest, leash in the military man's hand, pulling hard toward the gurney and being held back with clear effort. On the gurney was a man built like something structural, even unconscious, even bleeding, even in the context of a stretcher being pushed at a run. He had a physicality that registered. He was maybe 35 with the kind of facial scar tissue that spoke to years of work that didn't happen behind desks. His left shoulder was packed with trauma gauze, already saturated through. His right forearm had a pressure wrap that was doing its job, barely. His vitals, Emily caught from the monitor the paramedic was holding, were declining in the specific way that said he's compensating and it won't last. "Trauma Bay 1, the triage nurse called out, and then, almost immediately, over the intercom. "Dr. Hargrove to Trauma Bay 1. Dr. Hargrove, Trauma Bay 1. Dr. Marcus Hargrove was the chief of surgery at Raven Creek. He was 53, silver-haired, and had a professional reputation that he cultivated with the same deliberateness that other men applied to their investment portfolios. He had been at Raven Creek for 9 years, had published extensively on military trauma protocols, and was broadly considered, at least within the hospital's own administration, to be the most competent physician on staff. He arrived in Trauma Bay 1 within 90 seconds, which was fast enough to be impressive and slow enough that Emily had already assessed the patient's airway, noted the unequal breath sounds on the left side, and was thinking about what that meant. Carter. Hargrove didn't look at her directly. He looked at the patient, then at the paramedics, then at the military man with the dog. Clear the bay. I need Duval and Reyes in here. Respiratory on standby. The breath sounds on the left are diminished, Emily said. Hargrove turned then. He looked at her the way people look at a noise that shouldn't be there. I'm aware of how to assess a patient, Nurse Carter. I know, I just... Stay out of this. His voice didn't rise. It didn't need to. This is beyond your scope. Go back to your station. She went. Or she went as far as the edge of the trauma bay curtain, which wasn't technically her station, but wasn't technically the trauma bay either, and she stood there and watched through the gap because something about the way the dog was behaving was pulling at something she couldn't name. The Malinois, Blaze, she'd heard the military man say it quietly while trying to calm the animal, was not behaving the way dogs behaved in hospitals. In Emily's experience, which included a brief rotation at a VA facility, working dogs brought in with injured handlers either shut down or became anxious and restless. Blaze was doing neither. He was focused, locked on the gurney with an intensity that seemed almost cognitive, like he was monitoring rather than grieving, and when the military man moved him 3 feet to the left to get him out of the way of the medical team, Blaze turned his head and looked at Emily. Just looked at her. She didn't know why that felt significant. Inside the bay, things moved with the efficient noise of controlled emergency medicine. Hargrove called orders. Duval, the attending on call, confirmed them. A respiratory tech arrived with an intubation kit. The numbers on the monitor stabilized slightly and then resumed their slow deterioration, and Emily watched Hargrove's face go through the micro-expressions that physicians made when what they were doing wasn't working the way they'd expected it to. He'd missed it. She was fairly certain he'd missed it. The diminished breath sounds on the left, combined with the trajectory of the wound at the shoulder, the angle, the entry point she'd noted when they wheeled him past, pointed toward something specific. She ran through it again in her head the way she'd been trained to run through things, fast, systematic, committed. The numbers kept dropping. She pushed through the curtain. Carter, Hargrove's voice was ice. There's air in the left pleural space, she said. The trajectory of the wound it's not just soft tissue. You need to decompress before you intubate or you're going to make it worse. The room went quiet in that specific way rooms went quiet when something socially out of order had happened. Remove her, Hargrove said. He said it to nobody in particular. Dennis Kowalski, who had appeared in the doorway at some point, touched Emily's arm. Emily, come on. The monitor. Now. She let Dennis pull her back. She stood in the hallway outside the curtain and listened to the monitor, and 40 seconds later the alarm that she had been hearing in her head, building toward like weather, went off. The tone of a deteriorating patient in a hospital has a particular quality. It isn't just sound, it's weight. It changes the air in a hallway. Emily heard it and felt her jaw tighten. Inside the bay, voices sharpened. Hargrove called for something, then countermanded himself. The respiratory tech said something Emily couldn't make out. The monitor tone changed pitch. She went back through the curtain. Nobody tried to stop her this time. What she did in the next 4 minutes was not complicated, medically speaking. It was not the kind of thing that required unusual equipment or exceptional physical strength. It required knowing what to do, being certain enough of that knowledge to act on it without pausing to get permission, and having hands that didn't shake when people around you were actively telling you that you shouldn't be there. She called for a needle decompression kit. A nurse she'd worked with for 2 years, Sandra, mid-40s, who had always been professionally warm toward Emily and was currently looking at her with an expression that mixed alarm and something else, something that Emily didn't have time to read, handed her one without speaking. You are not, Hargrove began. Second intercostal space, mid-clavicular line, Emily said, not to him, to herself, the way she'd been taught to narrate the procedure, to keep her own thinking on track. She found the landmark. She'd found this landmark in conditions that made this trauma bay, with its backup generators and its heated air and its full supply cart, looked like a resort. She decompressed. The sound was immediate, air releasing. And then the monitor. The tone shifted. Not dramatically, not in the movie way where everything suddenly resolves and everyone looks relieved. Just the slow, measurable movement of a number in the right direction. Then another number. The patient's oxygen saturation, which had been dropping toward a place from which it would be very difficult to return, began its climb. Hargrove said nothing. The respiratory tech said quietly, "Sats are coming up." Duval was looking at Emily with an expression she couldn't categorize. "Intubate now," Emily said, because the window was there, and it needed to happen. "He's stable enough for 30 seconds. Do it now." Duval intubated. The numbers continued to improve. The alarm tone cut off. Emily stepped back. Her hands were steady. They were always steady. She hated that about herself sometimes, the way the calm showed up in her body even when her mind was somewhere else entirely. Hargrove turned to look at her, and the expression on his face was not gratitude. It was not relief. It was the particular expression of a man who had been made to look insufficient in front of witnesses and who was already calculating what to do about it. "Get out of my trauma bay," he said. Very quiet. The kind of quiet that meant the loudness would come later, in a different room, in a conversation with an administrator. Emily left. In the hallway, she stood with her back against the wall and breathed. The Malinois, Blaze, was 3 feet away, still on his leash, still held by the military man who hadn't left. The dog was watching her with that same focused attention as before. "Good boy," she said, for no particular reason. Her voice came out lower than she expected. Blaze moved toward her as far as the leash allowed. The military man let him go, and the dog pressed the top of his head against Emily's hand the way working dogs sometimes did with people they recognized, a specific gesture. Not random affection, but something trained into them, something that meant "I know you." Emily looked up at the military man. He was watching her with the same intensity as his dog, and she didn't like what she saw in his face, because it was the beginning of a question she wasn't ready to answer. "He doesn't do that," the man said. "Not with strangers." "Dogs are funny sometimes," Emily said. "Master Sergeant Blaze is a lot of things. Funny isn't one of them." She looked at her own hand, still resting on the dog's head, and didn't say anything. The man's name, she'd find out over the next hour, was Lieutenant Cord Rayner. He was the operational liaison for a SEAL team element based out of a facility Emily had never heard of, which was exactly how those facilities were designed, to be places nobody had heard of. The wounded man on the gurney was Petty Officer First Class Dale Warwick, and he was alive because of what Emily had done in the last 4 minutes, which meant he would continue to be alive while Hargrove filed whatever paperwork he was already drafting in his head about her conduct. She should have been angrier about that. She wasn't sure why she wasn't. She went back to the nurse's station and picked up the guard kid's chart and finished the entry she'd been in the middle of when the doors opened. Her handwriting was steady. The notes were precise. She documented what she'd observed about Mr. Warwick as part of her standard documentation, factual and clinical, nothing that couldn't be supported. Dennis found her there 30 minutes later. "Hargrove wants a meeting," he said. He looked uncomfortable. Dennis was the kind of man who was uncomfortable when institutions were in conflict with themselves, because institutions were the only thing he'd ever really trusted. "I figured," Emily said, "tonight or tomorrow morning. His call." "What did you tell him?" "I told him you were still on shift." Dennis paused. "Which you are. Until 7. "Right." Dennis hesitated in the way of someone who has more to say and has decided for reasons of professional self-preservation not to say it. "You probably should have let them handle it." Emily looked at him. "He would have died, Dennis." Dennis nodded slowly. "I know." A pause. "That's not really the point, though. Not here." She knew what he meant. She'd known it for the 3 years she'd worked at Raven Creek. There was medicine and there was institutional medicine, and they weren't always the same thing. And the version that happened inside a hospital building with a hierarchy and a budget and a chief of surgery who had published papers was almost never the same as the version that happened when the version that actually worked was the only thing standing between a person and a body bag. She didn't say any of that to Dennis. She said, "I'll be at the meeting." He nodded and left. She went back to the guard kid, who was finally ready to be discharged, and walked him through his care instructions with the same attention she gave every patient. He was 19, scared under the bravado, and when she told him the hand would heal clean if he followed up with ortho, he relaxed in the way that 19-year-olds relaxed when an adult told them with total confidence that things would be okay. She wished someone would tell her that. At 4:15 in the morning, Cord Rayner found her in the supply hallway. He was carrying a paper cup of coffee that he must have gotten from somewhere, and he held it out to her. "You don't have to do that," she said. "I know." He kept holding it out. She took it. It was bad coffee, the kind that came from a machine and had been sitting in a warming carafe for an hour past the point of dignity. She drank it anyway. "How long have you been a nurse?" he asked. The question was calibrated to sound casual. It wasn't. 3 years at this facility, she said. Nursing degree before that. And before the nursing degree? She looked at him over the rim of the cup. He had the face of a man who had learned to ask questions sideways, the long way around, because direct routes had too often gotten him answers that weren't complete. "Why do you ask?" she said. "Because Blaze has been in 4 combat deployments and 2 stateside training cycles, and he has never—" Rayner stopped. "He recognized something about you. I told you, dogs are— He doesn't do that with strangers. I've been with that dog for 6 years, and I've seen him around every kind of person, and he doesn't do that with strangers." His voice wasn't aggressive. That was the thing about it. It was almost gentle. "What did you do before you were a nurse?" The supply hallway was beige and fluorescent and smelled of antiseptic and packaged plastic, and it was possibly the least cinematic setting in the world for the conversation that Emily could feel was coming toward her like headlights on a dark road. "I had another job," she said. "What kind of job?" She handed him back the empty cup. "Thank you for the coffee, Lieutenant." She walked back out onto the floor, and she felt his eyes follow her, and she did not look back. At 6:30 in the morning, Dale Warwick, stabilized, intubated, moved to the surgical ICU, had a visitor. Emily knew because Sandra mentioned it at handoff, the way nurses mention things that were unusual and therefore worth noting. A senior officer, Sandra said, full dress, had come in from wherever these people came from, had gone straight to the SICU and asked about the nurse who had intervened in the trauma bay. Emily was writing her end-of-shift notes when Kowalski came back. "Hargrove moved the meeting to 8 a.m., he said. "His office." "Okay." "Emily." He stopped. He looked at her for a moment with something she couldn't read. "Is there anything I should know before that meeting?" She thought about Blaze pressing his head into her hand. She thought about the decompression needle finding the right space in the dark of muscle memory. She thought about the look on Cord Rayner's face when he asked what she did before she was a nurse. "No," she said. She went to finish her notes. And then Warwick's monitor, visible from the nurse's station through the SICU window, registered a change. Not a crisis, not a decline, just the shift in baseline that sometimes happened as heavily sedated patients processed their situation, and his eyes opened for the first time since they'd brought him in. He didn't look at the ceiling. He didn't look at the equipment, or the IV pole, or the door. He turned his head with the slow deliberateness of someone fighting through sedation, and he looked directly through the window at the nurse's station where Emily was sitting, as if he had known exactly where she was. His mouth moved. Through the glass and the intubation tape, she couldn't read all of it, but she'd spent years reading mouths in conditions where the words couldn't be heard and the shape of what he said was unmistakable. "You were there before." Her pen stopped moving on the page. Outside, the storm had not let up. Her pen stayed where it was, pressed to the page, not moving. Dale Warwick's eyes closed again 30 seconds later. The sedation pulling him back under, the body's demand for stillness winning out over whatever part of his brain had surfaced long enough to find her face in the window. The monitor resumed its steady rhythm. The SICU nurse on duty moved to check his lines without urgency, the way she would for any patient whose numbers were holding. Emily looked down at her notes. The sentence she'd been writing was incomplete. She finished it. Then she sat for a moment with the pen in her hand and said nothing to nobody, and thought about what a man who had never met her could possibly mean by "you were there before." She didn't let herself answer that. She capped the pen. She finished the shift documentation. At 7:04, she handed off to the morning team, received no particular acknowledgement from the day charge nurse, and went to the staff locker room to change out of her scrubs. She had 53 minutes before Hargrove's meeting, which was enough time to change, not enough time to go home, and exactly the wrong amount of time to sit somewhere quiet and think about things she'd spent 3 years not thinking about. She bought a coffee from the machine in the basement corridor. Different machine than the one Rayner must have used. This one slightly less bad, and sat in the small waiting area outside radiology, which at 7 in the morning was empty and dim and smelled of old carpet and the particular institutional quiet of a hospital between shifts. She was on her second cup when Sandra found her. Sandra Okafor had been a nurse for 18 years, had worked at Raven Creek for 6 of them, and had the kind of professional manner that was warm enough to be trusted and careful enough to have survived a long time in a place where survival required a degree of caution. She sat down without asking, which meant this wasn't a social visit. "Hargrove's already been to administration," Sandra said. Emily looked at her. "This morning?" "He called Beaumont at home, 6 a.m. Beaumont was the hospital director. Gerald Beaumont, a man Emily had spoken to exactly twice, both times in all-staff meetings where he stood at a podium and used the word excellence frequently and specifically. "He filed a formal complaint against you for practicing outside your scope in a restricted trauma bay." "I know he would." "Emily?" Sandra paused. "He's framing it as patient endangerment." That landed differently than the rest of it. Emily held the coffee cup with both hands and kept her face even. The patient's oxygen saturation went from 82 to 97 in 4 minutes. "I know what the numbers did. I was there." Sandra's voice was level, but her hands were folded tight in her lap. "I'm telling you what Hargrove told Beaumont, which is that an uncredentialed nurse performed an unauthorized invasive procedure on a critical military patient and compromised the treatment environment. He was dying." "I know he was dying." Sandra met her eyes directly. "I'm not arguing with you. I'm telling you what the meeting at 8 o'clock is going to look like." Emily sat with that. Outside in the corridor, a supply cart went by, its wheels uneven on the tile, the sound fading. "Is Rayner going to be there?" she asked. "I don't know who that is." "The military liaison. He came in with Warwick." Sandra shook her head slowly. "I don't know. What I know is that Beaumont agreed to attend the meeting, which means this isn't a conversation. It's a verdict." Emily nodded. She finished the coffee. It was bad, and she finished it anyway, and she stood up. "Thank you," she said, "for telling me." Sandra stood too. She looked like she wanted to say something else, something that lived in the space between professional and personal that neither of them had ever quite crossed in 3 years of working the same floor. She didn't say it. She put her hand briefly on Emily's arm and then walked back toward the elevator without looking back. Emily went to change her shoes because the meeting was in 40 minutes, and she was going to walk in there with clean shoes and her back straight, and that was the only preparation she had available to her. The meeting was in Hargrove's office, which was large enough to have a conference table in addition to his desk, and which he was using the conference table for, which told Emily this was being staged to look collaborative when it was not. Hargrove sat on one side. Gerald Beaumont sat beside him, 60s, gray at the temples, the kind of administrator whose face was designed to communicate concern while actually communicating nothing. Dennis Kowalski was there, which she hadn't expected. He sat slightly apart from Hargrove and Beaumont and didn't look at Emily when she came in. There was a fourth person in the room. She didn't recognize him, 50s, civilian clothes, but posture that said otherwise, something about the way he held his coffee cup that suggested he held everything carefully. He didn't introduce himself. Emily sat down. Hargrove opened with the word protocol and used it 7 times in 3 minutes. Beaumont followed with scope of practice and liability exposure. Neither of them used the word patient, which she noticed. The complaint, as articulated, was that she had performed a needle thoracostomy, an invasive procedure, without physician authorization, in a restricted trauma environment, on a patient classified under military medical jurisdiction. Mr. Warwick is alive, Emily said when there was a pause. That is not the point of this conversation, Beaumont said. With respect, sir, it should be. Hargrove's expression didn't change. Nurse Carter, this institution has protocols for exactly these situations. Those protocols exist to protect patients and staff alike. When they are circumvented, regardless of outcome, it creates legal and operational risk that affects everyone in this facility. She looked at him. You had assessed for tension pneumothorax? A pause. Minute. Almost invisible. We were working through a full trauma assessment. His SATs were dropping at approximately 4 points per minute, she said. That's a window of about 90 seconds before hypoxic injury becomes a real concern. At the time of my intervention, we were past 60 seconds. Beaumont shifted in his chair. Nurse Carter, I'm not arguing that I violated protocol, she said. I did. I'm telling you why. The why, Hargrove said, is not a clinical defense. I know. She kept her voice even. You're going to suspend me. Nobody said anything to that, which was its own answer. I'd like to know, she said, what would have happened if I hadn't done it. That, Beaumont said, is speculative. The monitor data isn't speculative, it's in the chart. She looked at Dennis, because he was the only person in the room whose eyes she could read, and what she saw there was not what she wanted. He looked away. If you're suspending me, I'd like to know the terms. Hargrove looked at Beaumont. Something passed between them that wasn't spoken. Pending review, Beaumont said. 2 weeks, with pay. At the conclusion of the review period, a formal determination will be made regarding your continued employment at Raven Creek. 2 weeks pending review was the administrative language for we intend to let you go and we need time to paper the file. She'd been around hospitals long enough to know the vocabulary. All right, she said. She was halfway out of her chair when the man who hadn't introduced himself spoke for the first time. Miss Carter. His voice was quiet enough that it stopped the room. I have one question, if you're willing. She looked at him. What's your read on Mr. Warwick's current prognosis? Given what you observed during the intervention, Hargrove said, that question isn't appropriate to... I'm asking her, the man said. He wasn't rude about it. He was simply certain, in the way of someone for whom certainty was a professional habit. Emily sat back down. She thought about what she'd seen, the wound trajectory, the presentation, the way the decompression had resolved, the intubation, the numbers climbing. If there's no secondary bleed he hasn't presented yet, he's got good odds, she said. The lung will need monitoring for the next 72 hours. The shoulder repair is going to be complex. Depends what the imaging shows about the suprascapular structure. But he was responding well to the intubation when I left the bay. If nothing changes overnight, he'll make it. The man nodded slowly. Thank you, he said. That's all I needed. She left the room without looking at Hargrove. In the corridor outside, Cord Rayner was leaning against the opposite wall with Blaze sitting at his feet. He looked like he'd been there for a while. He looked like a man who was good at waiting. They suspend you? He asked. Pending review. He nodded like that was the answer he'd expected. The man in there, in the civilian clothes. Did he tell you his name? No? His name is Aldous Wren. He's a federal medical oversight liaison. He's not here for the hospital. Emily looked at him. Why is he here? Because Dale Warwick isn't just a SEAL. Rayner straightened up from the wall. He's a team leader in an active classified program, and when his medical status triggered emergency transport to a civilian facility, it also triggered a federal protocol. Wren's job is to make sure the medical care received at civilian facilities meets a certain standard. He paused. Specifically, to flag when it doesn't. She absorbed that. He's not flagging the hospital. No, Rayner said. He's not. Blaze stood up, ears forward, and walked to the end of his leash toward Emily. She didn't move toward him or away. What was it about the dog? Rayner asked. Walk me through it. Why did he recognize you? I told you, I don't know why. Emily. He said her name for the first time, and the directness of it stopped her. I've been awake for 31 hours. Ren has been awake longer. We are both here because Dale is alive and we need to understand why, and the answer keeps pointing at you. He wasn't threatening. There was something almost tired about it, the kind of honesty that came from too little sleep and too much at stake. I'm not asking you to explain yourself to the hospital. I'm asking you to explain yourself to me. She looked at Blaze. The dog was watching her with those steady amber eyes, and the thing that she had been holding in the back of her mind all night, the thing she'd built 3 years of routine specifically to avoid, was pressing against the inside of her chest with the quiet insistence of something that has been patient for a long time and is running out of patience. I need to eat something, she said. I haven't eaten since yesterday afternoon. Raynor looked at her for a moment. There's a diner 2 blocks east. They have actual food. Blaze? He goes where I go. She put on her coat. The diner was called Terrace, and it was not particularly a terrace. It was a low-ceilinged room with vinyl booth seats and the kind of menu that hadn't changed since the 80s, and the morning light coming through salt-hazed windows looking like something between bleak and honest. They gave Blaze a bowl of water without being asked, which told Emily something about how often Raynor came here. She ordered eggs and toast. She wasn't sure she could eat, but her hands needed something to do while she talked. And she knew she was going to talk because the other option was to go home to her apartment and sit with what Warwick had said through the SICU window and never answer any of it. And that felt like its own kind of damage. I wasn't always a nurse, she said. She said it to the table, or to her coffee, or to nobody. Raynor waited. I was a combat trauma medic, attached to an ERVET unit, Emergency Rescue and Vascular Evacuation Team. We ran hot extractions. Went into forward positions to stabilize and extract critically wounded personnel when standard medevac wasn't viable. She watched his face. He was listening without reacting, which meant he'd either been briefed or he was very good. I was in for 6 years, she said. The last deployment was the one that... She stopped, picked it up again. We lost people. Not in the standard way. The way where you go over what happened and you can see every decision that was made and the sequence of it and how different choices at different points might have changed the outcome. And you have to carry that. She looked at her coffee. I separated, got my nursing degree, came here. Why Raven Creek? It's a military hospital. Because I'm better at this than at most things, and I needed somewhere to do it. She paused. I thought, proximity without involvement. Close enough to use the skills, far enough from the part that cost me. Raynor turned his cup in his hands. Dale Warwick, he said. You said you don't recognize him. I don't. You've been on 12 separate operational support cycles across 3 theaters in your ERVET service record. He said it without drama, which meant he'd had time to pull the file. You stabilized or extracted 41 personnel across those cycles. The unit operated under classified cover on several of those deployments. He paused. It's possible Warwick was one of the 41, and it was dark enough that you never saw his face clearly. She thought about that. It's possible, she said. And Blaze? She looked at the dog, lying at Raynor's feet with his head on his paws. Before Blaze was Dale's working dog, he was assigned to another handler, Raynor said, a specialist named Tomas. He was killed in the same operational environment where your unit ran its last active cycle. He let that sit for a second. You might have been there when that happened. The eggs arrived. Emily looked at them. What do you want from me, Lieutenant? She said. Not unkind, just exact. Right now? Nothing. He turned his coffee cup again. But Aldous Wren is going to want to talk to you formally. He has the authority to compel that conversation if you're connected to a federal medical file, which your ERVET service record is. And the hospital's suspension? Wren's review supersedes Beaumont's. He said it like it was simple, which maybe it was from where he sat. What Hargrove filed this morning is going to be looked at very differently once your service record is in the same room as his complaint. She thought about that meeting, Hargrove's face, the 7 uses of the word protocol. He doesn't know, she said. Nobody at Raven Creek knows. Your service record is sealed below your nursing application. All they see is your nursing degree and your 3 years here. He paused. Someone made that decision very carefully. She looked at him sharply. What does that mean? It means your separation from the military wasn't standard. There are elements of how you were processed out that suggest someone above your pay grade made decisions about your file that weren't routine. He held up a hand. I'm not in a position to tell you more than that right now. Ren would be the one to... Raynor, she said it quietly. What happened to my file? He looked at her steadily. That's what I'm trying to find out. She sat with that while the eggs went cold. Outside on the sidewalk, the storm had gentled to a steady fall, thick and even, the kind that buried things quietly and made the whole world look simpler than it was. She ate half the eggs. She drank the coffee. She thought about a classified record and a sealed separation and a man who woke up from sedation and found her face across a room and said, "You were there before," like it was an accusation and a recognition at once. "I need to see Warwick," she said. "He's sedated." "When he comes out of it." Raynor looked at her for a long time. "That can be arranged." He paused. "There's a condition." She waited. "When Ren wants his conversation, you give it to him. No lawyer, no HR, just a direct sit-down. Whatever you know about the last deployment, whatever you remember about who made what calls, he needs it on the record." She thought about what she'd spent 3 years not thinking about. "Why?" she said. Raynor reached into the inside pocket of his jacket and put a folded document on the table between them. She looked at it without touching it. It was a single-page summary, the kind that was produced when a classified investigation had been running long enough to generate paperwork that needed to be explained to someone outside the clearance level. She touched the corner of it, unfolded it, read the first 3 lines. The subject was the operational environment she'd served in during her last deployment. The classification header was higher than anything that should have been in Raynor's jacket at a diner 2 blocks from a civilian hospital. And the finding, the preliminary finding of an investigation that had apparently been running for 2 years, was that personnel losses in that environment had not been the result of enemy action. She read it again. The words were specific and clinical, and they landed in her chest like something physical. She folded it back up. "How long have you known?" she said. 3 months? He took the document back. "Ren's been on it for 2 years. He got close enough to need someone who was actually there." He put the paper back in his pocket. "Then the transport flag came in on Dale, and your name was in the facility roster, and here we are at a diner at 8 in the morning. Emily sat with her hands around an empty coffee cup and thought about 41 extractions, and the last deployment, and the people who hadn't come home, and the decision she'd made to bury herself in a hospital that smelled like antiseptic and fluorescent light and call it a life. "I'll talk to Ren," she said. She stood, left money on the table, pulled on her coat. She was at the door when her phone buzzed. She looked at it. Unknown number. She answered anyway. The voice on the other end was Sandra's, and it was tighter than Sandra's voice ever got. "Emily, you need to come back." What happened? Warwick's SICU chart was just flagged by Hargrove's office. He's put a notation in the file that the intervention you performed may have introduced a complicating factor in the patient's presentation. A pause. He's trying to get Warwick transferred to another facility, tonight. Emily looked at Raynor, who had followed her to the door. "He can't do that," she said. "Not unilaterally. He'd need military medical clearance to transfer a patient under federal jurisdiction." "I know," Sandra said. "Which is why I'm telling you that someone in Hargrove's office made a call to the Regional Military Medical Authority at 07:45 this morning, and whoever they spoke to didn't ask the right questions." Emily's hand was tight on the phone. "Who authorized the transfer request?" she said. Sandra's pause lasted 2 full seconds. "The name on the authorization is someone in Beaumont's office, but the request was drafted by Hargrove." Another pause. Briefer. "Emily, there's a note attached to the transfer request. A medical note citing suspected procedural complication from unauthorized nursing intervention as the reason for transfer." The cold outside the diner door pressed against the glass. "He's trying to move Warwick before anyone can look at the chart," Emily said. "Before Ren can look at the chart," Sandra said. "Someone told Hargrove who Ren is, maybe an hour ago." Emily ended the call. She looked at Raynor. She didn't need to explain it. She could see from his face that he'd heard enough of the conversation to understand. "Ren's at the hospital," Raynor said, already moving toward the door. If Hargrove's trying to get Warwick out before Wren can review the medical record, he'd need the transfer to go through before 9 a.m., Emily said. That's when Wren's formal review access kicks in under the federal protocol. They were walking fast now, both of them, Blaze matching their pace without being told. It's 8:47, Rayner said. They ran. The snow was still coming down, thick and even, covering everything. And somewhere in a hospital 2 blocks away, a man who had been trying to hide something was moving fast to bury it before the wrong people started asking the right questions about why Emily Carter's service record had been sealed so carefully, and by whom, and what that quiet decision was actually protecting. They hit the front entrance at a run, which meant Blaze hit it at a controlled trot because he was better trained than either of them. And the automatic doors opened too slowly, and Emily went through sideways and was already moving toward the elevator bank before the cold had finished following her inside. Stairs, Rayner said behind her. She was already turning. The SICU was on the 3rd floor. The stairs were faster if you were willing to take them at the kind of pace that made the handrail necessary, and Emily was willing. She took them 2 at a time with Rayner half a step behind her, and the sound of Blaze's nails on the concrete ringing in the stairwell. And when she came through the 3rd floor door, she was breathing hard but functional, which was the only kind of breathing that mattered right now. The SICU corridor was wrong. She registered it before she could have said specifically what was wrong. The number of people in the hallway, the positioning of them, a transport gurney staged outside Bay 3 that hadn't been there an hour ago. A man she didn't recognize in hospital administrative scrubs was talking to the SICU charge nurse, a woman named Patel who Emily knew by sight, and Patel's face had the expression of someone who was receiving instructions she disagreed with and had not yet decided how hard to push back. Emily walked toward them. "You can't be in here," the administrative man said. He looked at a tablet in his hand and then at her badge, which was still clipped to her coat, and read staff nurse and had the red border that meant suspended. "Your access is restricted pending. Where's Wren?" she said to Patel. Patel looked at the administrative man. Then she looked at Emily. "Conference room B, 2nd floor." "The transfer paperwork," Emily said. "Has it been signed?" Patel hesitated 1 beat too long. "Has it been signed?" Emily said again. "The authorization came from Beaumont's office at 8:41, Patel said. "Transport is scheduled for 9:15. Emily turned around. "I need Wren," she said to Rayner. "Conference room B," he said, already moving. She looked back at the transport gurney. At Bay 3, where Warwick was behind a glass wall and a set of monitors that were doing their job, numbers holding where they needed to hold. Moving him now, with the shoulder unrepaired, with the lung still in the early monitoring window, with the intubation in place, was not a neutral medical decision. It was a risk, a calculable one, the kind that could be documented as reasonable by someone who knew how to write around the corners of a chart. But the risk was real, and she knew it, and Hargrove knew it too, which meant the decision to move him wasn't clinical. It was strategic. She went to find Wren. Conference room B was a narrow room on the 2nd floor used for interdepartmental meetings, and when Emily came through the door, Aldous Wren was standing at the far end of the table with the laptop open in front of him and a phone pressed to his ear and the expression of a man who had been awake long enough to have run out of patience for careful phrasing. He looked up when she came in. She held up a hand. "Give me a second," and he said something brief into the phone and ended the call. "The transfer," she said. "Hargrove's moving Warwick at 9:15. "I know." Wren closed the laptop. "I've been on the phone with the Regional Military Medical Authority for the last 12 minutes trying to establish whether the authorization was properly obtained." "Was it?" Wren looked at her with the specific expression of someone who has found the answer to a question and doesn't like it. "The authorization was granted. The person who granted it has a signature authority that technically covers this category of transfer." He paused. "The question is whether they were given accurate information about the patient's current medical status when they approved it." "They weren't," Emily said. "Warwick's lung is in a 72-hour monitoring window. His intubation is still in place. Moving him before the shoulder is repaired creates secondary risks that are well above threshold for a transfer of this type." "I need that in writing," Wren said. "I'm suspended." I need it in writing from someone with direct clinical knowledge of the patient's presentation. He looked at her steadily. I can designate you as a federal medical consultation resource under the same protocol that brought me here. It supersedes the hospital's suspension. She looked at him. How long does that take? She said. He turned his laptop back around and typed something. Done, he said. It's time-stamped at 8:53. You're now operating under Federal Consultation Authority. The suspension is superseded. He slid the laptop toward her. Write it. She sat down and wrote it. She wasn't a writer by training or inclination, but she knew how to document. The ERVET had required documentation under conditions that made this room look peaceful, and she'd learned to be precise because precision was the difference between a record that held and one that collapsed under scrutiny. She wrote what she'd observed, what the presentation indicated, what the risk profile of an early transfer looked like for a patient in Warwick's specific condition. She was specific about numbers and she was specific about timelines, and she did not editorialize. She finished in 6 minutes. Wren read it in 2. This is good, he said, and took it without elaborating. Rayner had positioned himself in the doorway, not blocking it, just present. The way military people were present in spaces they were monitoring. Blaze was at his side. Wren picked up his phone. What followed was 18 minutes that Emily experienced mostly from a chair in conference room B, which was not where she wanted to be, but was where Wren had told her to stay, and she stayed because she was operating under his authority now, and arguing about positioning felt wasteful. She could hear pieces of Wren's phone calls. He made 3 of them in sequence, each shorter than the last, each apparently escalating to a different authority. His voice didn't rise. He had the quality of someone who had long ago decided that volume was a tool for people who didn't have better ones. At 9:09, the transport team that had been staged outside Warwick's SICU bay was stood down. She heard it from Patel, who came to the door of conference room B and told her quietly, and whose face had relaxed from the tightness of earlier into something that wasn't quite relief but was adjacent to it. Wren got the regional authorization reversed, Emily said. The transfer is on hold pending federal medical review, Patel said, which means nobody moves that patient without Wren signing off. She paused. Hargrove's been informed. Emily sat with that for a moment. How did he take it? Patel made a small, precise expression. He's on the phone with Beaumont. Of course he is. Patel left. Rayner came back into the room and sat across from Emily, and they stayed there in the particular quiet of 2 people who have just stopped running and haven't yet figured out what comes next. Wren's going to need more than a 6-minute document, Rayner said. I know. The full conversation, what you told me at the diner, and the parts you didn't tell me. He was looking at the table, not at her. Wren's investigation, the 2-year one, the preliminary finding in that document, it has gaps, significant ones, specifically around the last 72 hours of your deployment cycle before separation. She looked at her hands on the table. There were 3 deaths, she said. She said it at about the volume of a normal conversation, and it still felt too loud in the room. In the last 48 hours, personnel I'd worked with, 2 were listed as hostile action. 1 was listed as a training accident. She stopped. And, Rayner said, I was there for one of them. Her voice was level. She'd had years to make it level. The one listed as a training accident. I was first on scene. I know what I saw and I know what the report said, and those 2 things were not the same. Rayner didn't move. I filed an informal query, she said, through a chain of command that I thought I could trust. 2 weeks later, I was processed out. The file was sealed. I was told the circumstances were classified and that my separation was in the best interest of the program. She paused. Nobody said don't talk about it. They didn't have to. Why didn't you push harder? Because I was 26, she said, and I was exhausted, and I didn't know who was doing what to protect what, and the person who might have helped me understand that was one of the 3 who died. She looked up, and because I was scared, I'm telling you that, I'm not making it sound better than it was. Rayner looked at her for a moment with something that wasn't quite sympathy, more like recognition. Wren needs the specific incident, he said. Date, location, what you observed, what the report said. I know. She pulled her coat sleeve straight. I'll give it to him. She meant it. She'd meant it since the diner. Maybe since earlier, maybe since Warwick's mouth had moved behind the SICU glass, and something in her had shifted in a way she couldn't reverse. 3 years of routine and proximity without involvement, and it had lasted exactly as long as a man with the right face and the right dog showing up in the right storm. Wren came back at 9:32. He sat down at the head of the table, and he looked like a man who had accomplished something and was already thinking about the next thing. "The transfer is blocked," he said, "permanently, pending the completion of the federal review." He looked at Emily. "Hargrove filed a counter-notification with Beaumont's office 6 minutes ago, alleging that I'm exceeding my authority. He's wrong, but he's going to push it, which means the next 12 hours are going to be loud." "What do you need?" she said. "Everything." He set a recorder on the table. Small, digital, the kind of thing that produced admissible records under federal protocol. "Start from the deployment cycle. I'll ask questions where I need to." She nodded. She talked for 40 minutes. She was not always coherent. There were places where the timeline was clear and places where the memory was more impression than sequence, and she said so. And Wren noted it without judgment. The incident, the one she'd been first on scene for, the one labeled training accident, she walked through methodically, the way she'd been trained to walk through trauma assessments, because it was the only way she knew to hold it steady. What she'd seen when she arrived, the positioning, the specifics that didn't align with the listed cause, the query she'd filed and the silence that had followed, and the separation orders 2 weeks later. When she finished, the room was quiet in a way that felt weighted. Wren stopped the recorder. "What I'm going to tell you," he said, "I'm telling you because you need the context, and because the investigation is far enough along that it's no longer a liability to disclose." He paused. "The deaths in your last deployment cycle weren't unrelated. There's evidence, documentary evidence, which we've been building for 2 years, that connects all three to a deliberate pattern of information suppression. Specifically, a suppression of concerns that had been raised through informal channels about an operational decision made above your command level." She looked at him. "The 3 people who died," she said slowly, "had each in different ways indicated awareness of the same concern," Wren said. "Your query was the 4th instance. The response to your query, the sealed file, the expedited separation, was consistent with the pattern." The room was very quiet. "Who?" she said. "We're close." He didn't look away. "But we need what you just gave me. Your account fills a gap in the timeline that we haven't been able to close from documentary evidence alone." She sat with that. The recorder was off. The table was institutional gray and slightly scuffed at the edges, and outside the window the snow was still falling, lighter now, and she was 32 years old and sitting in a conference room with evidence that the thing she'd been afraid to name for 6 years had a shape and a paper trail. "Why Warwick?" she said. "Why is he part of this?" "Warwick's operational file crosses into the same program," Wren said. "He was in theater during the period in question. He may have his own information." Wren paused. "Or he may have already given it, which is why his transport was being arranged on short notice to a facility where federal medical review isn't automatic." She looked at Rayner. "Hargrove was contacted," Rayner said. "Someone reached out to him after Wren arrived. Told him what a federal medical review could expose in the patient's file." He paused. "Someone who knew what Warwick might be carrying." "The same someone who sealed my file," Emily said. "Potentially." She put both hands flat on the table and breathed. There were things she could manage and things she couldn't, and she had spent 3 years living exclusively on the side of what she could manage, and that had been, in its way, a functional life. But functional and sufficient were not the same thing, and she had always known that, and the knowing had been there under the routine the way a structural problem was there under a finished wall. She pushed her chair back. "I need to check on Warwick." "He's still sedated," Wren said. "I know." She stood up. "That's not why." She went back to the SICU and stood outside Bay 3 and looked at Warwick through the glass. His numbers were holding. The intubation was doing its job. His face in stillness had the quality of someone who carried something, even unconscious, some weight in the set of his jaw and the lines at his eyes. He was 41 or so, she estimated. Old for the work he'd been doing. She was standing there when the second alarm went off. Not Warwick's. Something down the hall, the far end of the SICU, Bay 7, where she knew from the whiteboard that there was a post-surgical patient, a military contractor who'd come in 2 days ago with a cardiac event. The alarm tone was the specific sequence that meant ventricular irregularity. Not a code, not yet, but the step before one. She was moving before she'd made a conscious decision to move. Bay 7 was 12 steps away. The nurse on duty, a young man named Torres, who Emily knew slightly, who was competent but still acquiring the particular calm that came with years, was already inside, looking at the monitor with the specific tension of someone who is doing the right thing and hoping it's enough. "Rhythm?" Emily said. "VTAC. Intermittent. He's been in normal sinus for the last 2 days." She looked at the monitor. The patient, male, 50s, pale but not ashen, was semi-responsive, looking at the ceiling with the unfocused attention of someone being pulled between alert and not. "His medication reconciliation," she said. "Who did the overnight reconciliation?" Torres reached for the chart. She was already scanning it. There. A dosage error. Not dramatic, not the kind that showed up immediately, the kind that accumulated over a cycle. An antiarrhythmic at a dose that had been appropriate at admission, but hadn't been adjusted as his kidney function numbers changed. And his kidney function had changed on the overnight labs in a way that meant the drug was accumulating and his heart was telling them so now. "Get Duval," she said. "Hargrove's covering, sir. Get Duval." She said it without heat, but without option. "Tell him it's a medication accumulation issue and I need a revised dosing order and I need it in the next 10 minutes. Torres went. She managed the patient's immediate presentation with the things available to her, repositioned him, talked him through staying calm in the way that was actually useful rather than just reassuring, monitored the rhythm with one eye on the clock and one on the numbers. The VTAC was intermittent, which meant the window was open and she needed it to stay open until the order came through. Duval arrived in 4 minutes. He looked at the chart, looked at her, looked at the monitor. "You flagged the accumulation issue?" he said. "The overnight labs show a 30% drop in creatinine clearance. The current dose is..." "I see it." He was already writing. "How long has he been in this rhythm?" Torres called it approximately 4 minutes before I came in. Intermittent. Duval wrote the revised order. He handed it to Torres. He looked at Emily with the same expression he'd had in the trauma bay 12 hours ago, the one she couldn't categorize, and this time she thought she understood it a little better. It was the expression of a physician who was recalibrating something. "Good catch," he said. Quiet. Not performative. "The overnight reconciliation process needs review," she said. "This shouldn't have made it to morning." Duval nodded. He didn't argue with her. He went to his patient. She stood in the doorway of Bay 7 and watched the monitor and waited for the rhythm to settle, which it did slowly over the next 7 minutes, the intervals normalizing as the new order was implemented. It wasn't dramatic. It was the unglamorous work of medicine, which was most of what medicine actually was, catching the thing before it became the crisis, then standing there while the numbers moved in the right direction and trying not to let the adrenaline convince you it was over until the numbers actually confirmed it. She went back to the corridor. Rayner was there. He'd followed her from conference room B at some point, or maybe he'd never stopped following her and Blaze was with him. "You're not supposed to be practicing," he said. "I'm not practicing," she said. "I'm consulting." He almost smiled. It was brief and slightly crooked, and then it was gone. She looked at her hands. Steady. Always steady. And then the elevator at the end of the corridor opened and Marcus Hargrove stepped out. He saw her immediately. He stopped for 1 full second. Just stopped, standing between the elevator doors while they tried to close against him. And his face went through something that was not quite what she'd expected. Not the administrative anger from the meeting. Something different. Something with more calculation in it. He stepped into the corridor. The doors closed behind him. "Miss Carter." He said it with deliberate precision. The miss rather than nurse, because the suspension was still technically in his paperwork, even if Wren had superseded it. "I wasn't aware you still had SICU access." "Federal consultation designation," she said, "as of 8:53. His jaw tightened slightly. I'm going to need to speak with Mr. Wren, he said, about the limits of that designation. He's in conference room B, Emily said. He's expecting you. Something shifted in Hargrove's face. He hadn't expected that. He'd expected her to be defensive or uncertain, and she was neither, and the absence of those things reorganized his approach in real time, and she could see it happening. The patient in Bay 7, she said. The medication reconciliation error in his overnight dosing. It should be flagged for a department review. Dr. Duvall's already been informed. I'm aware of what happens in my own unit, Hargrove said. Of course, she held his gaze. The error was in the reconciliation process, not individual clinical judgment. It's a systems issue. It should go to quality review. He looked at her for a moment with the particular expression of a man who is trying to decide whether what's happening is a threat or a coincidence and can't quite determine which. It will be addressed, he said. Good. He walked past her toward the conference room. She watched him go. Rayner came to stand beside her. What was that? He came to find out what I know, she said, and now he's going to find out what Wren has. They stood in the corridor and waited. Blaze sat between them, ears forward, facing the direction Hargrove had gone. The SICU monitors beeped their steady rhythms behind the glass. The snow outside the window was down to scattered flurries, the storm finally losing conviction. 12 minutes later, the door to conference room B opened. Wren came out first. He walked toward them with the deliberate stride of a man who has just confirmed something. Hargrove did not come out behind him. He's still in there? Rayner said. I have 2 federal investigators on their way from the regional office, Wren said. He looked at Emily. They'll be here within the hour. When they arrive, I need you available for a secondary statement. He paused. Hargrove just told me something he didn't intend to tell me. Emily looked at the closed door of conference room B. What did he say? He tried to argue that the transfer authorization was medically justified by citing specific details about Warwick's case that he should not have had access to. Wren's voice was flat. Details that were in Warwick's classified operational file, not his medical chart, which means someone gave them to him. He looked at her steadily. Which means the connection between this hospital and whoever sealed your file isn't coincidental. The hallway felt very still. He's not just a bad doctor covering a mistake, Emily said. No, Wren said. He's not. She looked at the conference room door. She thought about Dale Warwick behind the glass, sedated and still. She thought about 3 deaths in a sealed file and a training accident that wasn't. She thought about 6 years and then 3 years, and the particular shape of a life built around not arriving at exactly this corridor at exactly this moment. And then Hargrove came out of the conference room. He had his phone in his hand and he was looking at it, not at them, and he walked past them toward the elevator with the measured pace of someone who is controlling something very carefully. He pressed the button. The elevator came. He got in. The doors closed. Wren's own phone buzzed. He looked at it. His face, which had been controlled since she'd met him, did something that she couldn't read. A small compression around the eyes. The investigators, Rayner said. They hit a delay? No. Wren looked up. Warwick's sedation is being lightened. He's going to surface in the next 30 to 45 minutes. He looked at Emily. He's been requesting something since they started the sedation reduction. She waited. He's been writing on the back of his hand, Wren said. The nurse finally read it clearly enough. It's a name. He paused. Your name. In the SICU behind them, a monitor tone shifted fractionally. Not an alarm, just the small adjustment of a body beginning to find its way back to the surface. And somewhere below them, in the lobby or the parking garage, or already in a vehicle moving through the remnants of the storm, Marcus Hargrove was on a phone call that Wren's investigators were 38 minutes away from being positioned to intercept. The interval between those two things was the narrowest margin Emily had stood in for a long time. She went to Warwick. That was the only thing to do with 38 minutes and a name written on the back of a man's hand, and she did it without asking Wren's permission because his authority covered her consultation and she was consulting. She pushed through the SICU door, checked in with Torres by eye contact alone. He nodded, which meant the numbers were stable, and went to Bay 3. Behind the glass, Warwick looked different than he had at 6:30. Not awake, not fully, but the sedation reduction had changed something in the quality of his stillness. He was moving back toward the surface the way people did. Small adjustments, the hands shifting, the brow doing things the conscious mind wouldn't authorize. His right hand was on top of the blanket, and she could see the ink on the back of it, smeared now from the monitoring tape and the gloves of whoever had read it. But the letters were still there in the specific block print of someone who had written with deliberate force because they weren't sure how long they had. Carter. She sat in the chair beside the bed. The chair was the kind that existed in every hospital room in the country. Plastic, slightly too low, positioned for visitors who needed to be present without being in the way. She sat in it and looked at his face and thought about a man who surfaced from sedation and spent whatever clarity he had writing her name. Warwick, she said. Not loud. The tone you used was someone you weren't sure could hear you, but thought might be able to. I'm here. His brow moved. A compression, and then a release. You don't have to come all the way up, she said. I'm not going anywhere. She meant it as a practical statement. She had 37 minutes before the investigators arrived, and she intended to be in this chair for them. But sitting there saying it, she understood it also as something else. The kind of sentence that was true in more directions than the literal one. His hand moved, not toward her, just a shift of the fingers, the small, involuntary motion of a body checking that it still had parts. She watched his vitals on the monitor above the bed. Steady. Slow climb in the right direction. She stayed. Behind her through the glass, she was aware of Wren and Rayner in the corridor. Wren was on his phone. Rayner was doing the thing he did, which was stand in a space and be present in it without demanding anything from it. Blaze had been made to sit outside the SICU entrance because hospital policy on working dogs in sterile units was clear, and even Wren's authority had limits. At 9 minutes into her vigil, Warwick's eyes opened. Not fully. A partial lift, the lids heavy with residual sedation, the pupils sluggish to respond to the light. He looked at the ceiling for a moment, and then his head turned, slowly and with visible effort, toward the chair. He found her face. He didn't look surprised. That was the thing about it. He looked like a man who has been waiting for something and has confirmed that it arrived. His mouth moved around the intubation. The tube prevented speech in the conventional sense, and she knew that, so she leaned forward and watched the shape of what he was trying to say the same way she'd watched him through the SICU window 6 hours ago. It took him 2 attempts. You came back. She looked at him for a moment. I never left, she said. I was here all night. His head moved slightly. Not quite a shake, not quite a nod. Something that meant, that's not what I meant. She understood. Later, she said. We'll talk later. When the tube's out and you have more to work with. She paused. Right now I need to ask you something, and I need you to blink once for yes and twice for no. Can you do that? 1 blink. The operational program, she said. The one Wren is investigating. Were you approached before your deployment? Someone asking you to provide information? 1 blink. Did you? His eyes stayed open for a long moment. Then 1 blink. Slow. Was the information about what happened in the last cycle? The deaths? 1 blink. Faster this time. She sat back in the chair. The monitor above him beeped its steady rhythm, and she watched it and thought about the shape of what she was assembling. Not quite a picture yet, more like the outline of one, the edges becoming clear. The man who arranged your transport, she said. Hargrove. Did you know him before last night? 2 blinks. But someone connected to him contacted you before you came in? His eyes held hers, and she watched him decide something, some calculation that even sedation hadn't fully suppressed. 1 blink. She leaned forward again. Warwick, the person who contacted you. Do you know their name? 1 blink. Can you write it? He lifted his right hand an inch off the blanket. His fingers moved. The effort it cost him was visible. The way his jaw tightened. The way his breathing changed on the monitor. She looked around for something he could write on and settled for her own forearm, which she offered him with a pen she'd taken from her coat pocket. His writing was slow and labored and not his normal handwriting, she suspected. The hand was wrong, and the position was wrong, and the sedation was still sitting in his joints. But the letters were legible. Aldrin. She looked at it on her arm, not Hargrove, a different name. A name she didn't recognize, which was its own information. She was still looking at it when the SICU door opened and Wren came in without knocking, which told her something had changed outside. "The investigators are here," he said. He looked at Warwick, who had let his hand drop and closed his eyes again. Not gone, just resting, the way people rested when they'd used what they had. "Early." 30 minutes early," Wren said. He looked at Emily's arm, at the name written there. Something moved in his face, a rapid internal adjustment. "Where did you get that?" She tilted her arm so he could read it more clearly. His expression confirmed what she'd suspected. He knew the name. "Tell me," she said. Wren looked at Warwick, then at Emily. Then he said, "Not here." And it wasn't dismissive, he thought. It was the specific phrasing of someone who means the walls of this particular room are not where I want this conversation to happen. She stood up. She put her hand briefly on the blanket near Warwick's arm, not touching him, just proximate, the way you indicated presence to someone whose eyes were closed. Then she followed Wren out. In the corridor, the investigators had taken over the small family waiting room at the end of the SICU hall. 2 of them, a man and a woman, both in the specific category of civilian clothes that signaled federal employment to anyone who knew the code. The woman introduced herself as Agent Soraya Vance. The man didn't introduce himself at all, which was its own introduction. Wren closed the door. "The name is Marcus Aldrin," Wren said. He was looking at the name on Emily's arm, not at her face. "He's a senior program director in a defense contracting entity that has held service contracts with the military medical system for the past 11 years. He paused. "Including contracts that covered the operational environment of Emily's last deployment." Vance was writing. "He's also," Wren continued, "the individual whose signature appears on 3 internal communications recommending expedited separation for personnel who raised informal concerns during Emily's service cycle." He looked at Emily. "Your query went to your command. Your command flagged it upward. It landed on Aldrin's desk." The room felt very still. "He had the authority to seal my file," Emily said. "He had the authority to recommend it. The actual sealing required military medical command authorization, which he obtained." Wren sat down at the waiting room table. "He also has a pre-existing professional relationship with Marcus Hargrove. They're on the board of a medical research foundation together. The foundation has received contracting funds from Aldrin's entity." "Hargrove is connected to Aldrin," Rayner said. "He'd been quiet since they entered the room. That's how Hargrove got access to Warwick's operational file details." "Aldrin provided them," Wren confirmed, "because Warwick reaching a federal medical review was a problem for him. Warwick's operational file contains documentation that corroborates the pattern we've been building." He looked at Vance. "The documentation that Warwick apparently provided to a federal contact 6 weeks ago." Vance looked up from her notes. "Which is why the transport was being arranged. Move Warwick before the review, and the documentation in his file becomes complicated," Wren said. "Jurisdictional issues, chain of custody questions, delays that could run into months while Aldrin's legal team works the angles." Emily sat down across from Wren. She was aware of being very tired in a way she hadn't let herself register while there was something to do, and now there was a pause in the something, and the tiredness was arriving. "What happens now?" she said. "Hargrove," Vance said, "is currently in his vehicle in the hospital parking structure. He has not left the premises." "You have someone on him?" Rayner said. "Since the elevator," Vance said, flat, professional. "His phone records are being subpoenaed as of 40 minutes ago. The call he made after leaving conference room B went to a number registered to a Shell LLC associated with Aldrin's contracting entity." She paused. "We don't need much more than we have, but we need the connection between Aldrin's operational recommendations and the specific deaths to be documented in testimony." She looked at Emily. "Your statement to Wren this morning is the strongest piece of direct witness testimony we have for the timeline." Emily looked at her own arm. The name there. She'd be washing it off eventually, but not yet. "What happens to Hargrove?" she said. That depends on how cooperative he is in the next few hours, Vance said. His exposure is significant. The transfer attempt alone, once we establish that he was acting on information obtained through an improper channel, constitutes obstruction. She paused. His 9-year record here is also going to be reviewed. The quality flags from overnight. The medication reconciliation error in Bay 7, Emily said. Vance looked at her. That's one of them. One of them. Emily sat with that phrase for a moment. She thought about 3 years of watching Hargrove operate in this building, the way he moved through it, the professional confidence that she had always read as competence and was now recontextualizing into something else. A man who had been insulated from scrutiny long enough to stop being careful. How many? She said. Quality review is ongoing, Vance said. What I can tell you is that when Wren's presence here triggered Hargrove's contact with Aldrin, it also triggered a wider records request from the Federal Medical Oversight Office. The review covers the last 4 years. She made a note. It's going to take time. Does Beaumont know? Rayner asked. Beaumont was contacted at 9:47, Wren said. He's been advised that federal investigators are on premises, that the review covers administrative decisions including the suspension issued this morning, and that his cooperation is expected. A pause. He's currently in his office with his attorney. Emily thought about Beaumont in his meeting this morning, the way he'd said scope of practice and liability exposure, and never once used the word patient. She thought about whether that made him complicit or just precisely the kind of administrator who created the conditions for complicit people to operate in comfort. Probably both. Those things were not mutually exclusive. I need to know about my file, she said to Wren. The seal. I need to know if it can be reversed. Wren looked at her steadily. That's part of what the investigation resolves. If Aldrin's recommendation is found to have been procedurally improper, and the evidence suggests it was, then the basis for the seal is invalidated. He paused. Your service record would be restored to its full state, including your ERVET commendations, which are significant. She hadn't known about commendations. She had known, abstractly, that the work she'd done had been valued, but the specific paperwork of that valuation had been sealed along with everything else, and she'd spent 3 years operating as though it didn't exist because that was easier than knowing it was there and inaccessible. Okay, she said. It came out smaller than she intended. Wren looked at her for a moment with something that was not quite sympathy, more like respect, the kind that came from understanding what a thing had cost. Get some sleep, he said. We'll need you available for the formal statement this afternoon, but the next few hours are paperwork and phone calls, and you've been on for... He glanced at his watch. Approximately 26 hours. 27, she said. Go find a cot. There are call rooms on the second floor. She stood. She looked at Rayner. He gave her a small nod that meant, go, I'll be here. Things are in motion. She went and found a call room on the second floor, which was a small rectangle with a narrow bed and a door that locked, and a window that looked at a concrete wall, and she lay down without taking off her shoes and was asleep in about 4 minutes. She slept for 3 hours and woke up to her phone buzzing. Sandra. Are you in the building? Sandra said when Emily picked up. Second floor call room? What happened? Hargrove just came back in from the parking structure. Sandra's voice had something in it that Emily hadn't heard from her before, a particular tension that was adjacent to urgency. He went to his office, and now there are 2 federal agents outside his door, and Beaumont is in the hallway, and the nursing staff are watching from the station, and nobody is telling anybody anything. Emily sat up. Her shoes were still on, which she registered as a small act of past self-providence. Is Wren there? He's with the agents. A pause. Emily, Hargrove made an announcement before he went into his office. He walked through the ER, which he never does, and he stopped at the nurse's station, and he said, Sandra paused again, as if she was deciding whether to quote directly or summarize, and chose direct. He said, I want it on record that any clinical decisions made in this facility over the past 24 hours that fall outside standard protocol are the direct result of interference by a suspended employee, and I will be making a full accounting of the harm done. Emily stood up. He said it to the room, she said, to the nurse's station specifically. To everyone within hearing range of the nurse's station, which at 9:30 in the morning is about 15 people. She put her hand on the door. "Stay where you are," Sandra said. "I'm not telling you this so you come down and do something that costs you. I'm telling you because you need to know what he's doing." Emily stayed where she was. She looked at the concrete wall outside the window. What Hargrove was doing was building a narrative in the record, in the informal record, the one that existed in the memory of 15 people who would be interviewed at some point. He was pre-positioning the story. If the investigation came for him, he wanted witnesses who remembered him saying it first, who could attest to his concern, his documentation, his stated worry about protocol violations. It was smart. It was also what someone did when they knew the ground was moving under them, and they were trying to stake a position on solid earth before it tilted further. "He's scared," Emily said. "He looks it," Sandra said, "although he's working hard not to show it." "Okay," she breathed. "I'm coming down, not to the nurse's station, to find Wren." She found him outside Hargrove's office, as Sandra had said. The two investigators were there, Vance and the unnamed man, and Hargrove's office door was closed, and from inside it Emily could hear faintly the sound of voices that were choosing their words with care. "He came back in," she said to Wren. "I know." "Why? He was in his car. He could have left." Wren looked at the office door. His attorney advised him that voluntary departure from the premises at this juncture could be characterized as flight. He came back to demonstrate he wasn't running. A pause. "He's also trying to get to his office files before we get a records hold in place." "Did you get the hold?" "It was in place before he got to the elevator," Wren said. He almost smiled. Not quite. His system credentials were suspended at 10:43. He walked into an office where he can't access anything. Emily looked at the closed door. She thought about 9 years of a career built on reputation and institutional protection, and the particular armor of a man who had never been seriously challenged because the institution had always, when it came down to it, chosen itself. "When does it become public?" she said. Wren looked at her. "Some of it already is. The quality review request from the Federal Medical Oversight Office is a matter of public record once it's filed, which it was at." He checked his phone. 11:07 this morning. "Any media organization monitoring federal regulatory filings will have it within a few hours." She nodded. The door to Hargrove's office opened. Hargrove came out with a man Emily assumed was his attorney. 50s, the specific type of well-dressed that said expensive and aware of it. Hargrove's face was composed. He had the composure of someone who had practiced it, and she could see the practice from here. He looked at Vance. "My client is prepared to answer questions in a voluntary capacity," the attorney said, "with the understanding that any information provided is given in the spirit of cooperation and not to be construed as the spirit of cooperation is noted," Vance said. "We'll begin in conference room A in 20 minutes. She looked at her phone. "My colleague has some preliminary questions for you, Doctor, if you'll follow him." Hargrove followed the unnamed investigator. He didn't look at Emily. She wasn't sure if that was strategic or if looking at her had become a thing he was no longer able to make himself do. She watched him go. "The formal investigation," she said to Wren. "Aldrin, what's the timeline?" "He's being contacted today." Wren's voice was careful. "He's not within our immediate jurisdiction. The hospital is, the medical oversight review is, but the broader criminal question about the deaths and the information suppression is being coordinated with another agency." He looked at her. "It will move. These things move slower than we want them to, but the file you gave me this morning, combined with what Warwick has already provided, and what Hargrove is likely to provide in the next 2 hours in exchange for whatever his attorney can negotiate, it moves." She heard what was under that. It moves, but not today. Maybe not this week. This part, the hospital, the suspension, the transfer attempt, that closes today. The rest has a longer shape. She'd been in systems long enough to understand the shape of that. It wasn't what she wanted, but it was what was, and there was a difference between those two things that she'd learned to hold without it breaking her, mostly. "Warwick," she said, "when is the tube coming out?" "The pulmonologist is assessing him at 1 p.m., Wren said. "If the numbers continue, extubation by 3. "I want to be there." "I'll make sure of it." She went back to the nurse's station. Not because she was back on shift. Technically, she was still under a suspension that was being reviewed and hadn't yet been formally lifted, but because the nurse's station was where she'd spent 3 years, and it was familiar, and she needed something familiar right now. Sandra was there, and Torres, and two other nurses Emily knew by face and name, and the particular shorthand of people who worked too many hours together to maintain formal register. Nobody said anything direct. Sandra poured her a coffee without being asked. Torres showed her the morning's chart updates without explaining why. It was the language of a workplace that was recalibrating something without having fully articulated what. At 12:47, Gerald Beaumont came to the nurse's station. He looked like a man who had spent the morning with his attorney and had not found the experience restorative. He looked at Emily, and then at the station generally, and then at Emily again. "Nurse Carter," he said, "I've been advised by the Federal Oversight Office that your suspension is to be treated as administratively nullified pending the completion of the review." He said it like he was reading from something, which he probably was, internally. "You are reinstated to your clinical position effective," he checked his phone, "11:59 this morning." Sandra was extremely still in the way of someone who is controlling a response. "Thank you," Emily said. Beaumont nodded. He looked like he wanted to say something else and had been advised not to. He left. Torres exhaled. "Administratively nullified," Sandra said. "That's a phrase." "It means it's gone," Emily said, "from the record." "I know what it means." Sandra looked at her over the coffee cup. "I just wanted to say it out loud." At 3:14 in the afternoon, the pulmonologist extubated Dale Warwick. Emily was there, as Wren had arranged, standing back from the direct clinical activity because it wasn't her procedure and she knew the difference between being present and being in the way. She watched the tube come out, watched Warwick's face go through the specific passage of a body reclaiming a function it had been doing on its behalf, and then watched him breathe on his own, imperfectly, with effort, the first several breaths shallow and experimental, and then settle into something that was his own. He coughed. He made a sound that was not a word, but was in the territory of words. His eyes opened fully for the first time, and the sedation was genuinely clear now, the quality of consciousness different, present, anchored. He looked at Emily. "Hey," he said. His voice was rough from the tube and barely above a whisper, but it was a voice. "Hey," she said. "You look terrible," he said. She almost laughed. It surprised her, the almost laugh. "I've been up for a long time," she said. "Me too." He shifted slightly against the bed. "How long was I?" "About 16 hours on the vent." She moved to the chair beside the bed, the same chair as before. "You're going to be sore in the throat for a few days. Everything else is looking okay." He looked at the ceiling. His right hand moved to his face, checking the tape, the monitoring leads, the landscape of himself. His eyes landed on the name on his hand, now very smeared. "Did you read that?" he said. "I read it." She paused. "Wren has the name." Warwick's eyes came back to her. Something in them settled. The particular settling of a man who has been holding a thing carefully for a long time and has been told he can put it down now. "I knew you were at Raven Creek," he said, 3 months ago, when I started talking to the federal contact. He pulled personnel records from the region, and your name was in the roster, and I thought—" He stopped, coughed. She waited. "I thought if it came to it, if there was someone who could confirm the timeline from inside. You were there that last cycle." "I know," she said. "I was first on scene, the training accident." "It wasn't a training accident." He said it plainly, in the voice of a man who has said the true thing after a long time of not saying it. "I know that too," she said. He looked at her. "You filed a query." 2 weeks later, I was separated." "I know," he said. "I found out after. I've been carrying that for a long time." She didn't say anything to that. There wasn't a response that was adequate to it, and she'd learned the hard way that the attempt to respond adequately to inadequate things was its own kind of damage. Raynor came in at some point. She registered him in the doorway, Blaze at his side, the dog's ears forward and his attention on Warwick with the focused quality that she now understood was recognition rather than instinct. Warwick saw the dog and something moved across his face, the specific emotion of a person encountering something they thought they'd lost, which was not quite happiness and not quite grief, but contained both. "Hey, buddy," Warwick said. His voice cracked on it. Blaze made a sound, low, brief, the sound of a dog who is being professional about the fact that he is very glad someone is alive. Rayner let the leash out, and Blaze walked to the bedside and put his chin on the blanket near Warwick's hand and stayed there. Emily stood up. "I'll let you have a few minutes," she said. Warwick looked at her as she moved toward the door. "Carter," she stopped. "That last cycle, what you did before you queried, the people you got out, the stabilizations you ran under fire, I was there for 2 of them." He held her gaze. "I know what you did, and I know what it cost, and I know what they did to you for asking the question after." She stood in the doorway. "You didn't deserve any of it," he said. She didn't have a response to that either. She nodded once, which was the best she could do, and went out into the corridor. At 4:51 p.m., Marcus Hargrove was formally placed on administrative leave by federal order, pending the outcome of both the quality review and the obstruction investigation. The notice was delivered by Vance to Hargrove in Conference Room A, where he had been for most of the afternoon, and was copied to Beaumont and to the hospital's board of directors. At 5:17, Beaumont issued a facility-wide communication acknowledging the federal review and suspending Hargrove's clinical privileges pending its outcome. It was the kind of communication that said very little directly and an enormous amount by implication, and by 5:30 it had been read by everyone in the building who had an email address. Emily read it at the nurse's station. Sandra read it beside her. 9 years, Sandra said. "Yeah. Did you know? Before last night, did you have any sense that he was... I knew he was the kind of person who made the institution more important than the work," Emily said. "I didn't know how far that went." Sandra was quiet for a moment. "The Bay 7 patient. The reconciliation error." "He'll be okay," Emily said. "Duval caught it. The number's been stable all day." "I know, I checked." Sandra paused. "How many others do you think?" Emily looked at the email on the screen, the careful language of it, the conspicuous absence of an apology. "The quality review will find out," she said. At 6:40 p.m., Aldous Wren came to the nurse's station with a document on a tablet. He held it out to Emily. "Your service record," he said. "The seal has been lifted, effective at 4 p.m. today by emergency review order." He paused. "The formal restoration is pending the completion of the full investigation, but the operational seal, the one that prevented you from accessing your own file, is removed." She took the tablet. She looked at her own name at the top of the document, her service years, her unit designation, ERVET, third operational cycle. The deployment locations, some of them names she hadn't seen in 3 years, some of them places that existed for her only as a particular quality of cold or heat or the sound of rotors. She scrolled to the commendations section. There were 4 of them. She read each one slowly. The language was military and formal, and underneath it was the specific reality of 4 separate moments, 4 separate times when someone above her had observed what she'd done and had found the language to say, in the way the military found language for things. This person did something that mattered, under conditions that would have excused them from doing it. Her eyes were dry. She was aware of being the kind of tired that made emotion operate at a distance, observable but not fully accessible. She handed the tablet back to Wren. "Thank you," she said. He looked at her for a moment. "There's one more thing," he said. "Something that came out of Hargrove's interview this afternoon." She waited. "The contact who reached out to Hargrove said Aldrin's representative, Kimal, communicated something specific to Hargrove when they told him about Warwick's operational file." Wren's voice was precise. "They told Hargrove that if the Federal Review made contact with Emily Carter's sealed service record, Aldrin's legal team would make the argument that Emily's original query was itself a security breach, that she had improperly disclosed classified information by asking the question." He paused. "It wasn't true, and it never would have held, but the argument was designed to make Emily criminally liable as a way to prevent her from cooperating with the investigation." She absorbed that. They were going to come after me, she said. They were planning to, Wren said. The plan required Warwick to be transferred and your file to remain sealed. With neither of those things in place, the argument collapses. He held her gaze. But I need you to understand that someone spent 3 months building that plan. The transfer attempt, the suspension, the narrative about unauthorized clinical interference. It was coordinated. It wasn't Hargrove improvising. It was a prepared response. The nurses' station was quiet around them. Someone at the far end of the counter was documenting. A monitor somewhere beeped in the middle distance. The institutional sounds of a building that kept going. Who coordinated it, she said. Aldrin directed it, Wren said. Hargrove executed it here. There are 2 other individuals in the chain whose names I can give you once the warrants are served. He paused. The warrants are being drafted tonight. Emily looked at the window. Outside, the last of the storm's light was going. Blue-gray and fading, the sky the color of old metal. The snow had stopped hours ago, and the parking lot below was cleared in the haphazard way of places that had cleared it fast rather than well, ridges and patches of white between the lanes. A coordinated plan. 3 months of preparation. Warwick's operational file as a liability, her sealed record as a weapon. The suspension as a way to remove her from the premises before the review could establish what she knew. She thought about the morning she'd come to work 3 years ago. The hospital ID they'd given her, staff nurse level 2. The clean, orderly shape of a job that made sense in a building where the rules were clear and the hierarchy was stable and nothing was going to ask her to remember things she had decided not to remember. She thought about the ambulance bay doors opening in a storm. They miscalculated, she said. Wren raised an eyebrow. They built the plan around me being a nurse, she said. Someone they could suspend. Someone whose scope of practice was limited. Someone the hospital would choose to protect itself from rather than protect. She paused. They didn't account for what I actually am. Wren looked at her for a long moment. No, he said. They didn't. She turned back to the station. There were charts to review. She was reinstated, which meant there were charts. And she picked up the first one and opened it and looked at the name at the top and thought about the person in the room at the end of the chart and what they needed. Her phone was on the counter. It buzzed once. She looked at it. An unknown number. Not the same unknown number as Sandra's call that morning. A different one, with a regional prefix she didn't recognize. She picked it up. The voice on the other end was a man she had never heard before. He identified himself in 3 words that placed him at a level of the organizational structure she'd thought she'd left behind permanently. Miss Carter, he said. This is Deputy Surgeon General Ferris. I understand you've had a complicated 24 hours. She stood very still. I'm calling because I've been briefed on the events at Raven Creek, he said. And because what I've been told about your service record, your actions last night, and your testimony this morning requires me to make you an offer that isn't customary at this stage of an investigation. She waited. The offer, he said, comes from my office directly. It concerns a specific role within the military medical system that has been vacant for 8 months because we haven't been able to find someone who meets the full criteria. A pause. I've been told you might. The nurse's station was quiet around her. Sandra was watching from 3 feet away with the careful non-expression of someone who could hear one side of a conversation and was choosing not to. What role? Emily said. He told her. She stood at the nurse's station of Raven Creek Military Hospital with her reinstated badge clipped to her coat and 4 commendations in her service record and the name Aldrin written on her arm in a dead man's, no, a living man's, she corrected herself, handwriting, and she listened to Deputy Surgeon General Ferris describe a position that was not a nurse's position and was not a medic's position and was not anything she'd let herself imagine for 3 years. When he finished, there was a silence. I'd need to think about it, she said. Of course. A pause. There's a timeline, Miss Carter. The role has operational implications that make it time-sensitive. Another pause, shorter. I'd also like you to know that I've read your service record. The full version, not the sealed one. His voice changed register slightly, something below the official tone. I owe you an apology on behalf of this institution. What happened to your file should not have happened. I'm telling you that on the record. She looked at the window, the parking lot, the last gray light. I appreciate that, she said. I'll send the details tonight, he said. We'll speak again tomorrow. The call ended. She put the phone down. Sandra looked at her. What was that? Emily looked at the chart in her hand. The name at the top. The person in the room at the end of it. I'm not sure yet, she said. Which was true. And also in some way she hadn't had time to examine yet. Not true at all, Set. Because the thing Ferris had described, when she held it up against what she was and what she had, and what 3 years of a small life had cost her, wasn't a question. She just needed to hear it again in the morning, when she'd slept, to be sure she wasn't making the decision for the wrong reasons. She opened the chart and got back to work. And down in the parking structure, in a car that had not moved in 7 hours, Marcus Hargrove sat with his phone and a legal pad full of notes, and the knowledge that the warrants being drafted tonight contained his name, and one other name, a name that, when Aldrin's legal team saw it in the morning, was going to make a very specific phone call to a very specific government official, and what that official said in response was going to determine whether the next 6 months of this investigation moved toward a trial or toward something else entirely. The legal pad was full of numbers, dates, the names of decisions, and the names of people who had made them. Hargrove had been building his own case for the last 5 hours. Not a defense exactly, but an accounting. The specific accounting of a man who has decided that if he is going down, the geometry of the fall should take into account everyone who told him the ground was safe. He picked up his phone. He called Aldrin's number. It rang 4 times and went to voicemail, which had never happened before in 9 years. He looked at the phone in his hand for a moment. Then he called his attorney instead and started talking, and what he said in the next 40 minutes would rewrite, substantially, the scope of what federal investigators thought they were looking for. Hargrove talked for 40 minutes that night, and the ripple from it was still moving 3 weeks later when the first warrants were served. Emily wasn't in the building when that happened. She found out through Wren, who called her on a Tuesday morning while she was in her apartment eating toast over the kitchen sink, a habit she'd never bothered to correct. Eating standing up, the particular domesticity of someone who had spent enough years eating in motion that stillness at a table felt performative. Wren's voice on the phone was the same as it always was, which was to say controlled and precise and carrying information without editorializing about it. Marcus Aldrin had been taken into federal custody at 6:47 a.m. at his residence in a suburb she'd never heard of, which was exactly the kind of suburb a man like Aldrin would live in. Prosperous, anonymous, the kind of place that asked nothing of you as long as you maintained the lawn. 2 associates from his contracting entity had been brought in simultaneously at separate locations. The warrants covered fraud, obstruction, and a charge related to the improper suppression of official military medical records, which was a specific statute that Wren had mentioned to her once and which carried consequences that were not minor. She stood at the kitchen sink with the toast going cold in her hand and listened to Wren read the charges. Hargrove, she said when he finished. He entered a cooperation agreement 4 days ago, Wren said. The details aren't public yet, but his testimony is what made the Aldrin warrant possible. He gave them dates, communications, the financial relationship between his foundation board position and Aldrin's contracting entity. A pause. His clinical privileges have been permanently revoked. He won't practice medicine again. She looked out the window. November now. The trees past their color, bare branches against a sky that hadn't decided yet what it wanted to be. The 3 deaths, she said. The investigation is ongoing, Wren said. What I can tell you is that the preliminary finding from 2 years ago, the one in the document Rayner showed you, has been upgraded to a formal determination. The circumstances of those deaths are being actively investigated as a criminal matter. He paused, and she heard something careful in the pause. It will take time. These things always take longer than they should, but it's moving, and it won't stop moving. She thought about 3 people. She let herself think about them specifically, which she'd spent 6 years mostly not doing. Their faces, the work they'd done, the particular and irreplaceable fact of them. It hurt in the way that grief hurt when you finally let it be grief instead of something you were managing. Thank you, she said, for calling. There's one more thing, Wren said. The formal review of Hargrove's tenure at Raven Creek is complete. The Quality Board issued its findings yesterday. 7 cases flagged for inadequate clinical response over 4 years. 2 of those cases are being referred for further review by the State Medical Licensing Authority. He paused. Beaumont's office has issued a statement accepting the findings and committing to a comprehensive restructuring of the hospital's quality oversight process. She put the toast down on the counter. And Beaumont himself? She said. He resigned last week, Wren said, quietly. The board accepted it. She'd known it was coming. The administrative logic of it was clear enough. But hearing it confirmed was still something. 9 years of Hargrove, 11 years of Beaumont, the institution they had shaped between them, the culture of protection over patient that had been so thoroughly the air of that building that she'd breathed it every shift without quite naming what it was. Okay, she said. Emily. Wren said her name in a way that was different from his usual register, less official. How are you? She thought about it. The genuine version of the answer was complicated. She was tired in a way that had been with her for a long time, and was only now starting to loosen. She was something that might have been relief, but felt more like the absence of a weight she'd been carrying so long she'd forgotten it wasn't part of her. She was 32 years old and standing in a kitchen eating toast alone, and that was fine. That was actually fine, which was not nothing. I'm okay, she said. I think I'm actually okay. She meant it. She was surprised to mean it. She called Deputy Surgeon General Ferris that afternoon and told him her answer was yes. She'd known her answer the night he'd called her at the nurse's station, standing there with Sandra, watching from 3 feet away, and 4 commendations in a file she could finally read. She'd known it, and she'd made herself wait 3 weeks anyway, because the version of her that had made decisions while exhausted and emotionally activated had a mixed track record, and she'd learned to give the important ones room to breathe. The decision held. 3 weeks later, it was still the right answer. Ferris sounded neither surprised nor particularly relieved. He sounded like a man who had been told the thing he'd expected to be told and was already thinking about the next step. She appreciated that about him. She didn't need the answer to be celebrated. She needed it to be taken seriously, which he did. The role was a regional trauma coordination position within the military medical system, a newly created office that was itself a product of the investigation, of what the investigation had found about the gaps between civilian and military medical response, the places where people like Warwick fell between institutional jurisdictions, and the care they received depended on whoever happened to be standing in the right room at the right time. The job was building something that hadn't existed before, which meant it would be slow and incomplete and frequently frustrating, and it would matter in the specific way that things mattered when they were trying to close a gap that had cost people. She understood gaps. She had been one for 3 years, a person-shaped space in a system that had needed her and hadn't known where to put her. She gave Raven Creek 4 weeks' notice. She didn't need to. The formal reinstatement had been temporary, a status that reflected her consultation role during the investigation rather than a permanent return to her staff position, and the investigation was concluded. But she gave the 4 weeks because there were patients in the middle of care transitions, and she didn't want to leave in a way that cost them. The work was still the work, regardless of everything around it. Sandra threw her a going-away thing in the staff break room on the last Friday. It was not a party in any ambitious sense. A sheet cake from the grocery store down the block, coffee from the machine that was still bad, people standing around in scrubs between shifts saying the things people said. Emily stood with a paper plate and ate the cake and received the awkward warmth of people who worked in a place that had recently been turned inside out and were trying to figure out what to feel about the person who had been the proximate cause of the turning. Torres gave her a card. Everyone on the shift had signed it. She read it in the car afterward, in the parking lot, the heater running, and the messages inside were the specific mixture of people being genuine and people being bad at expressing genuine things, and it was more affecting than she'd expected. She sat there for a longer moment than she'd planned to, looking at the signatures, and didn't try to rush the moment into something smaller. Warwick's extubation had been a Tuesday. By the following Monday, he was out of the SICU. By the end of the second week, he was ambulatory with supervision, which he received from Rayner and from a rotating presence of people from his team who came in ones and twos quietly, the way military people visited their own. Emily came twice during that period, Once to check in clinically, once because he'd sent a message through Rayner asking if she had time, and she'd had time. The second visit, they sat in the small room the hospital had moved him to, which had a window with an actual view, the parking lot, and beyond it the edge of the lake, and beyond that the winter sky. And they talked for an hour in the way that two people talked when they had been connected by a serious thing and were now in the aftermath of it, trying to find the register for ordinary conversation. He was not an easy person to talk to. She suspected she wasn't either. They managed. He told her about the federal contact he'd made 6 weeks before the storm, a decision he'd made after a year of carrying the same information she'd been carrying, but from a different angle, with different details. He told her what he'd documented, what he'd given over, the risk calculation he'd made about how to do it without the wrong people finding out before the right people had enough to act. She listened without interrupting, which was something she was better at than most people assumed given how she operated in clinical environments. "You were first on scene for Tomas," he said, at some point. He said it directly, without preamble. He was that kind of person. "Yes," she said. "He was my—" He stopped, picked a word. "We came up together. He was the person I would have called if something happened to me." He looked at the window. In a different version of events, that's exactly what would have happened. Something happened to me, they called Tomas, and we figured it out together. She sat with that for a moment. "Different version," she said. "Yeah." He turned back from the window. "This version had you in it instead, which, considering how things went, I'm not going to complain about." She almost smiled. It was the same almost smile as the one Rayner had almost given her in the SICU corridor, and she wondered if that was something in the population of people who did this kind of work, a particular compression around expressiveness that came from spending too long in situations where the wrong display at the wrong moment had consequences. "The offer from Ferris," Warwick said. "You taking it? How do you know about that?" "Rayner." "Of course." She looked at the window. The lake was frozen at the edges, the center still dark water. "Yes, I'm taking it." "Good." He said it simply. "It's the right role for you." "You don't know what the role is." "I know enough." He shifted against the bed, which still gave him trouble on the left side, and she watched him manage it with the specific stoicism of someone who knew perfectly well it was going to hurt and had decided the hurt was not going to be the main event. "You're better than a hospital." She looked at him. "I don't mean that as a criticism of hospitals," he said. "I mean that what you are and what you do, it operates at a scale that a single facility can't use. You burned 27 hours covering a staff shortage and then saved my life in between. A system like that is a waste of what you have." She didn't say anything to that, not because she disagreed with it, she didn't entirely, but because receiving the accurate assessment of what you were worth from someone who had reason to know was a different experience than she'd expected. It wasn't the uncomplicated warmth that vindication was supposed to feel like in the narratives. It was more complicated than that. It sat alongside the 3 years and the sealed file and the 19-hour shifts and the particular loneliness of being competent in a place that didn't want to look at your competence too closely. It sat alongside all of that without canceling any of it. The vindication was real, and the cost was real, and both things were true at the same time. "Thank you," she said, "for writing my name." He looked at her. Something in his face was very direct and very tired at once. "Thank you for being here to write it too." The formal public statement from the Federal Medical Oversight Office came out on a Thursday, 6 days before Emily's last shift at Raven Creek. She read it on her phone over breakfast. At the table this time, not the sink, she'd been working on that. And the language was formal and bureaucratic, and underneath it was, in plain terms, the following: that a pattern of information suppression within a military-adjacent medical contracting structure had resulted in the improper separation of military medical personnel, the concealment of circumstances surrounding 3 deaths, and a coordinated obstruction of federal medical review at Raven Creek Military Hospital. That the personnel responsible had been identified and were subject to ongoing legal proceedings, and that steps were being taken to ensure that the service records of affected individuals were restored, and that the institutional record reflected accurately what had occurred. Her name was not in the statement. The statement wasn't about her. It was about the shape of what had happened and who was responsible. Her name was in the appendix, in the section titled Personnel Records Corrected, which was a dry phrase for the thing it described. The formal restoration of 6 years of service, 4 commendations, and a deployment record that had been sealed away from her own access for 3 years. The appendix was not the part that made the news, but it was the part she read 3 times, alone in her apartment at a kitchen table with coffee going cold beside her. And the 3rd time she read it, she sat very still for a moment and did not try to make the stillness into anything other than what it was. Aldrin's trial date was set for the following spring. His 2 associates had entered guilty pleas in early December. The financial relationship between Aldrin's contracting entity and Hargrove's foundation was being examined as part of a broader federal review of military medical contracting that had expanded well beyond the original scope of Wren's investigation. The kind of expansion that happened when the initial thread, pulled carefully, revealed that the fabric it was attached to was considerably larger than the thread had suggested. Hargrove's cooperation had been extensive. Whatever he'd said in those 40 minutes to his attorney in the parking structure and in the formal interviews afterward had been specific and well documented. The accounting of a man who had kept careful records and had finally decided that the records were more valuable as a negotiation than as protection. His cooperation agreement reduced his personal criminal exposure significantly. His career was over. His clinical privileges were gone. The specific shape of consequence he'd received, not prison, but the permanent loss of the only identity that had ever mattered to him, was something Emily thought about occasionally, not with satisfaction exactly, but with the particular acknowledgement of someone watching a complicated equation resolve. He'd made choices. Over 9 years, across 7 cases, with Aldrin, and with the culture of the place, and with the individual moments where he'd had the option to do the harder thing and had chosen the easier one. The choices had been his. The consequences were proportionate to them. That was justice functioning the way justice was supposed to function, which was imperfectly and slowly, and with the frustrating tendency to resolve partial rather than total. Aldrin's legal team would fight the criminal charges for a year at minimum, and some portion of what he'd done would probably never be precisely accounted for, but moving, definitively, in the direction it was meant to move. She'd stopped needing it to be cleaner than that. At some point in the weeks after the storm, the part of her that had wanted the neat resolution, the complete accounting, the full acknowledgement, the version of events where every harm was precisely addressed, had given way to something more realistic and, in its realism, more sustainable. The truth was out. The people responsible were identified and facing consequences. The record was restored. The dead were being looked at honestly for the first time. That was enough. Not everything, not complete, but enough to build from. On the morning of her last shift, she arrived at 6:50 a.m., and it was snowing again. The first real snow since the storm 3 weeks ago, lighter this time, the kind that came down straight and quiet without any agenda. She stood at the entrance for a moment and looked at it and thought about ambulance bay doors opening and the cold arriving before anything else. Then she went inside and worked the shift. It was a normal shift. That was the thing about it. Nothing dramatic, nothing that required anyone to recalibrate anything. A pediatric asthma case, a fracture, 2 medication consults, an elderly man with chest pain who turned out to be having a panic attack and who she sat with for 20 minutes talking about what had changed in his life lately, because the medical part of his presentation was resolved and the rest of it was what had actually brought him to the ER at 7 in the morning, and talking about it seemed to be what he needed. His name was Roland, and he had recently retired from 40 years in insurance, and he admitted with the specific, embarrassed honesty of someone discovering a thing about themselves they hadn't expected, struggling with the silence of days that didn't have structure anymore. She listened. She told him that was a real thing, not a weakness, and that it was worth talking to someone about who had more time than she had right now. He nodded in the careful way of someone who was going to think about it and probably not do it immediately and might eventually do it. That was the realistic version, and she gave him the realistic version, and that was fine. Rayner came in at noon. No Blaze. Blaze was with Warwick, who had been discharged to an outpatient recovery program and was doing the slow work of physical rehabilitation with the specific intensity of someone who had somewhere to be. Rayner came in civilian clothes, which was the first time she'd seen him without any of the operational presence, and he looked different. Not smaller, but more particular, like a person rather than a function. He found her at the nurse's station. "Last day," he said. "Last day. You ready?" She thought about it. She was, and she also understood that readiness for a thing was not the same as not being afraid of it. That you could be both at once, ready and uncertain, and that the uncertainty wasn't a disqualification. "Yeah," she said. He nodded. He stayed for a while, drinking bad coffee at the station, not requiring conversation from her. It was the thing she'd found she valued most about Rayner. He understood that presence and conversation were different offerings, and that sometimes what was needed was only the first one. Sandra found her at 2:15, an hour before the end of the shift, and handed her an envelope. Emily looked at it. "From the overnight team," Sandra said, "the ones who weren't here for the party." Inside was a card, and inside the card was a photograph. Someone had printed it from a security camera still, which should have been impossible but was apparently possible if you knew the right people in the facilities office and had a particular motivation. The photograph was from the ambulance bay camera, timestamped 3:11 a.m. on the morning of the storm. It showed the bay doors open and the gurney coming through and the medical team around it, and at the edge of the frame, partially cut off, was Emily, in her scrubs, her badge visible, standing at the boundary of the bay watching a situation that was about to require her. She looked at herself in the photograph, the posture, the attention in the set of her shoulders. She hadn't known she looked like that. She'd thought she'd been standing back. In the photograph, she was clearly already forward. "We thought you might want it," Sandra said. She put it back in the envelope and put the envelope in her bag and thought about the version of herself at 3:11 a.m., who had no idea that the next 27 hours were going to cost what they cost and return what they returned, who was standing at the edge of a trauma bay in a storm, making a decision she'd been making in one form or another her entire adult life. You moved forward. Not because you were certain it would work, not because the system invited you to, not because anyone in the room had designated you as the person with standing to act. You moved forward because you knew what to do, and there was a human being in front of you who needed it done. And the gap between those two facts was exactly the width of one decision. She'd spent 3 years trying to close that gap down to hospital scale, to scope of practice, to what the badge said she was authorized to do. She understood now that it didn't close. It was the wrong project. The gap wasn't a problem. The gap was the thing she was for. At 3 p.m., she handed off her last charts to the incoming nurse, a woman named Deja, who had started 3 months ago and was still in the phase of careful precision that came with not yet trusting her own instincts. Emily gave her the rundown, patient by patient, clean and thorough, the way she'd given every handoff for 3 years. And at the end, she looked at Deja directly and said, "Your instincts on the asthma case in Bay 2 were right before I confirmed them. Trust that." Deja looked slightly startled. "How did you—" "You hesitated before you called it," Emily said. "You were right before the hesitation. The hesitation was about permission, not the clinical picture." She paused. "You'll figure out the difference." She meant it as a practical observation, not a lesson, but she saw it land as both and didn't correct that. She put her badge on the counter. She walked out through the ER and through the lobby and through the front doors into the afternoon. The snow had stopped. The sky was the particular clean gray that came after snow, not dark and not light, the kind of sky that simply was what it was without apologizing for the weather. Blaze was there. He was sitting on the sidewalk outside the entrance, Warwick on one end of the leash and Rayner on the other side of Warwick. Warwick on a cane, which he was using with the purposeful dissatisfaction of a man who expected to need it for approximately another 3 weeks and was already tired of it. He looked better than he had in the bed. Upright suited him. She stopped. "You're supposed to be in the outpatient program," she said to Warwick. "Afternoons are optional," he said. Technically. "We wanted to see you off," Rayner said. She looked at the two of them. At Blaze, who stood up when she got close and came to the end of his leash with the same purposeful attention as always, and she bent down and put her hand on the top of his head and felt the weight of him leaning into it. "Good boy," she said. The same thing she'd said in the hallway at 3 in the morning, 3 weeks ago, the first time. "He's going to miss you," Rayner said. "He'll be fine," she said. She straightened up. You'll all be fine. Warwick looked at her. His face in the open air and the gray light was different from the face she'd sat beside in the hospital room. Less monitored, less careful. More himself, whatever that was. Ferris sent me your job description, he said. She raised an eyebrow. Why would he send it to you? Because he's asking me to consult on the operational parameters, Warwick said. Once I'm cleared. He paused. Apparently, there's a component of the role that involves coordinating with active unit medical needs during deployment transitions, which is, he made a small gesture with the hand that wasn't on the cane, apparently my area. She looked at him for a long moment. So we're going to be working together. Apparently, she thought about what to say to that and decided that nothing was the most accurate response. So she said nothing, and Warwick nodded like that was the right answer. She had a drive ahead of her. The new office was in a regional facility 3 hours away. Not so far that the drive was an event, but far enough that she'd be starting over in the specific and literal sense of a new apartment, new grocery store, new routes, the small infrastructure of a life rebuilt. She'd packed the apartment into the back of her car over the previous 2 days, which had not taken long because she hadn't accumulated much in 3 years, and the not much of it had made her feel something she was still sorting out, part lightness, part recognition of how thoroughly she'd kept herself temporary. She wasn't keeping herself temporary anymore. She was going somewhere to build something, which meant staying long enough to build it. She said goodbye to Rayner, who shook her hand and held it a beat longer than strictly necessary, and she let him. She looked at Warwick. Don't push the shoulder before the 6-week mark, she said. I know, he said. I mean it. I'll know if you do. You're not my doctor. I'm the person who decompressed your lung at 4 a.m, she said. I've earned an opinion. He almost smiled. The same almost smile. She was starting to think it was just his face. She got in her car. She sat for a moment with her hands on the wheel and looked through the windshield at the hospital. The building was not beautiful. It was a functional structure built in the way of functional structures, without particular attention to anything beyond capacity and access. The parking lot had the old snow in the corners that parking lot snow always had, the compacted gray remnants that lingered past when everything else had melted. The entrance doors opened and closed for someone going in, someone coming out. She thought about the first morning she'd walked through those doors with her level 2 badge and her nursing degree and the very specific plan she'd made to use what she had without getting close enough to what she was to have it cost her again. It had cost her anyway. That was the thing about plans built around avoidance. They couldn't actually prevent the thing. They could only delay the encounter and make you less prepared for it when it finally arrived. And it always arrived. She understood that now in a way she hadn't when she was 29 and building the plan. What she hadn't understood then, what the last 3 weeks had told her, in the specific language of events rather than the abstract language of knowing, was that the cost wasn't only loss. The cost was also what the loss made room for. The sealed file had been sealed. The record had been buried. She had spent 3 years at reduced scale in a place that didn't know what it had. And then a storm had come, and the doors had opened, and the gap had been exactly her width, and she had stepped into it, not because she was brave in the way that stories described bravery, because she knew what to do, and there was a person in front of her who needed it done. That was all it ever was. That was all it needed to be. She started the car. She pulled out of the parking lot and onto the road, and the city opened up ahead of her. The winter version of it, bare and gray and honest. And she drove through it toward the highway and the 3-hour route to whatever came next. The badge was on the seat beside her. Not the Raven Creek one. That was on the counter in the ER where she'd left it. This was the temporary credential that Ferris's office had sent her, the one she'd need for her first day at the new facility. It had her name on it and her title, not staff nurse, level 2, and the federal medical oversight insignia in the corner. She didn't look at it while she drove. She didn't need to. She knew what it said. She knew what she was. She had always known. That was the thing that people like Hargrove never understood about people like Emily Carter. That the dismissal didn't create the limitation they assumed was there. It just created the interval between what someone was and what the room was willing to see. And intervals, however long, however costly, were not permanent. They were just time. She had spent her time. The highway opened up and she accelerated and the city fell behind her, and the road ahead was the specific kind of open that was both literal and not, and she drove into it the way she had always moved toward the thing that needed doing. Without waiting for permission, without waiting for the room to decide she had standing, without waiting for anyone to see her first. She had stopped waiting. That was the whole of it. That was the thing she would carry forward. Not the vindication, not the title, not even the restored record, though all of those things mattered, and she was done pretending they didn't. What she would carry was this: the understanding that the woman who got pushed to the back of a trauma bay at 3 a.m. was the same woman who stepped back into it 4 minutes later, and that neither version was a mistake, and that the strength it took to hold both of those moments without collapsing the distance between them into something simpler, that strength was not the kind that showed up in titles or commendations or the restored appendix of a federal statement. It was the kind that had always been there, quiet, patient, waiting for the gap to be exactly the right width. She drove. The snow began again, light and unhurried, and the road stretched ahead, and Emily Carter, trauma medic, nurse, the woman they had underestimated in every room she had ever stood in, drove toward the work that had always been waiting for her, in the steady way of someone who was, at last, exactly where she was supposed to be.